BASIL 2 trial. Bypass versus endovascular first for severe limb ischemia. Let's dive in. Hey everyone. Welcome back to the channel. Today, we're breaking down the BASIL 2 trial. Yeah, that's right. We're talking about the big study comparing bypass surgery and endovascular therapy for people dealing with severe limb ischemia. So let's set the stage. Objective. The goal? To see which works better as a first step. Modern endovascular therapy or the more traditional surgical bypass for folks with chronic limb-threatening ischemia. Big words, but basically, we're talking about some serious blockage in the leg arteries. Study design. This was a multi-center, randomized controlled trial, all based in the UK. Super solid setup. Population. They enrolled 345 patients, all with chronic limb-threatening ischemia, meaning these people had rest pain or even tissue loss, and who were good candidates for either procedure. Now, how did they set up the showdown? Endovascular first. Think angioplasty, sometimes with stents or drug-coated balloons. Minimally invasive stuff. Bypass first. That's the classic surgical bypass, preferably using the patient's own vein for the graft. Alright, let's talk outcomes. What were they looking for? Primary outcome. Amputation-free survival at 1 year. That's the gold standard for these patients. Keep the leg and stay alive. Secondary outcomes. Major adverse limb events. Male. Economic impact. And quality of life. Because it's not just about surviving, it's about how you live. So, what did they find? The results came out in 2023. No significant difference in 1 year amputation-free survival. Endovascular first at 76% versus bypass first at 71%. Statistically, that's a wash. P equals 0.23. However, bypass first had more 30-day complications. Think wound infections and longer hospital stays. Not fun. On the other hand, endovascular first needed more follow-up procedures, but the initial treatment was way less invasive. When it comes to costs, endovascular first was cheaper in the short term. Long-term numbers? Still coming in. So stay tuned. Let's wrap this up. What's the big picture? Endovascular first is a safe and less invasive option, with similar short-term outcomes to bypass surgery. Bypass is still the go-to for certain patients, especially when the anatomy is right for a long-segment vein graft. It really comes down to individualizing care, looking at the patient's risk. In summary, this trial backs up the global move toward an endovascular first strategy for modern chronic limb-threatening ischemia care, and it's a great talking point for shared decision-making with high-risk patients. Thanks for tuning in. If you found this breakdown helpful, don't forget to like, subscribe, and hit that bell for more deep dives into the latest in surgery. It's the Everything Surgery Podcast. Dissect the extraordinary.